Hi everyone, and welcome to your community partner, brought to you by Lehigh Valley Hospital Schuylkill. Once again, bringing you a lot of great information. Joining me now is the president of Lehigh Valley Hospital here in Schuylkill and president of Lehigh Valley Health Network Northwest Region, my good friend Terry Purcell. How are you, Terrence?
Good, Sam. How are you?
You know, it's interesting. I'm coming down to do the show today, and 25 years ago, we were started down here with the good Sam, right? And, you know, doing It's Your Health and stuff. And I remember all of the great things that the hospital was doing in healthcare. And I look back 25 years and say, wow, you know, how we've changed in healthcare, you know, and you know, particularly with the merger now with Jefferson Hospital. So there's so much to be said about what's going on, and it's good to have a show like this so we can explain to the viewers all the great things that are happening in Lehigh Valley. Am I correct in saying that?
Absolutely. We used to have two 200-bed hospitals in Pottsville 25 years ago, and now we're down to one med-surg hospital and one specialty hospital.
What's new with the merger?
So not a lot has happened locally with the merger. A lot of things that are happening. They've appointed a lot of different leaderships in the networks. They've taken some great leaders from Lehigh Valley and given them responsibility down at Jefferson and vice versa. So we're realigning our leadership team at both networks right now. We're working on probably the biggest thing that's going to impact our community is rolling out the health plan. Jefferson has 3 health plans, one for Medicare residents, one for Medicaid residents, and one for the marketplace. So Schuylkill's in all 3 plans. So that will be rolled out.
What are they? What do they explain? Some of those plans.
So if you're a Medicare and you take a Medicare Advantage, you have your choice. What type of Medicare Advantage plan do you want to take? And with the Jefferson plan, there's special benefits. So for example, you may get hearing aids through the Jefferson Medicare Advantage. So there's different benefits. So you shop and see what's the best thing for you individually and which plan.
That's always confusing, you know, so people are, which plan, and you hear this and then you hear that. So what do you advise them to do in terms of learning about these different benefits?
Probably the best thing you could do is reach out to a benefit broker. There's a lot of brokers throughout Pennsylvania and in Schuylkill County. A good friend of mine is one of the benefit brokers, and they could educate you on what the differences in the plans, the out-of-pocket maximums, and really help you make an educated decision. So at Jefferson, we do a lot of training programs for the brokers. So they're really fully educated on what the health plans offer.
So it seems to be a good plan.
It's going to be great. Absolutely, it's going to really benefit our local community. So
I think you should look into it, because there's a lot of people that ask me, you know, Sammy, you get confused and they don't know which direction to go into. And what are the other 2 plans you had? The Medicaid.
The Medicaid residents have one as well, and one on the marketplace, the old Obamacare. So consumers, if they don't have insurance and they want to buy it through the marketplace, they can now choose the Jefferson Health Plan.
Okay, so does that apply to? Do you have to be a certain age?
No.
The marketplace.
In the market, you don't have to be. You just have to be under 65.
Is that right?
And then if you have Medicare,
so
you
they
go
have
to
single, and they have family, and
they do.
The same thing is. Other ones.
So now they have a local choice that you could use the best of Lehigh Valley Health Network and the best of Jefferson Health Network.
Let's talk about the CMS 3-star rating leapfrog.
So we've been focusing a lot on quality over the last couple of years. You know, if you take care of the quality, the finances will take care of itself. So our CMS star rating a few years ago, the CMS gives hospitals a star from 1 to 4. And at one point we were a 1-star hospital, and last year we went up to a 3-star just because of all of our focus on patient safety and quality improvements. So that was a very significant increase. There's a group called Leapfrog, and they just evaluate hospitals and health networks throughout the United States. And they just take information that we provide to the government, and they give you a grade. And it could be anywhere from an A to an F, just like in school. And I know you never got any Fs in school. So, so a couple years ago, we were a D-rated hospital. And now we're up to a B rating, and we're going to continue until we get that A rating.
And how do you achieve that?
By constant focus on patient safety, reducing infections, reducing falls, and just providing the right care at the right time. the Hospital Association of Pennsylvania gave out awards to 22 hospitals throughout Pennsylvania for improvements in patient safety and quality. And LVH Schuylkill was one of the 22 hospitals to get that award. So it just goes to show that all the focus that we're putting on patient safety and quality improvement is really being recognized statewide.
And so that brings us into the Press-Garney patient satisfaction survey.
Sure.
Okay, and how important are those inpatient scores? And I know we've said this before, but I want the viewers to really understand that this is really critical.
Very critical. So first thing we do every morning is look at our patient satisfaction scores. We've seen, in the past year, we've seen a 30% increase in our scores in general, and an emergency department has increased by 70%. So we've seen a really dramatic increase. So we really want to make sure that our patients are satisfied. We want to make sure we take good care of them, and they want to come back next time that they have an illness or an injury. We do a great job taking care of patients. When you look at all the questions that they score, we're at the 80th and 90th percentile. So we do a great job taking care of our patients, and if we didn't, we want to hear why not.
Do the hospitals ever get an impromptu inspection when people come in unexpectedly from the state or?
The state comes in several times a year. Joint Commission unannounced. Joint Commission comes in every 3 years unannounced. We used to get a half-hour notice, and now they won't even give us that. They just show up.
Oh. You have level 4 trauma. You have certified chest pain center, primary stroke center, which, I mean, all of these you have so much going on. Talk about those areas.
A year ago, we became accredited level 4 trauma center. And the first year you get it, it's a conditional approval, and they come back a year later to reevaluate to see how you did that year. We were expecting them to come back and give us a 2-year accreditation. That's normal for programs in this level of their infancy. At the end of the survey, they gave us a 4-year reaccreditation, which is incredible. And they said that doesn't happen often. They were just so impressed with all the care that we provide to local residents, and they're not coming back for 4 years. So we're really excited about it. They saw the engagement of our medical staff, our team, and they could tell we care for our patients.
Terry, how important are those accreditations?
They're very important. It's a seal of quality, seal of approval. So when you hear the surveyors commented and gave us compliments for probably about an hour on how all the great things they saw. And even though we're only a year into the program, they said the way we act, it's like you've had this accreditation for 6 or 7 years. So our team takes this very serious. And our stroke accreditation and chest pain are absolutely incredible. We had a stroke accreditation with no finding. So we got 100% satisfaction.
I hope you never have to use it, but if it's there, it's there.
But I think it's important for the community to know that we're well prepared to take care of a patient that has a heart attack or a stroke.
Exactly. Let's talk about the development of the LVPG Family Medicine in Pine Grove.
So we have a new building down in Pine Grove. It's about $1.3 million building that we put down there. Very much needed in the community. The Doctors Russell had done such a great job caring for that community over their career. So now we handed it over to young David. His father's still helping out, so he's still doing a few per diem hours for us. We added another nurse practitioner in that practice, and the Pine Grove location is a very busy area, so it's important for the community to know. We're right next to the pharmacy as well, so it's very convenient for the patients down there.
And that seems to be growing, that whole area there.
Absolutely.
The School of Nursing, okay, Joseph McCluskey School of Nursing. Let's talk about that. What's going with the students and how's everything going?
So during COVID, there was a shortage of nurses, and it's still not great today, but we began planning for it 4 years ago. And our goal was to expand the number of students that we take. We used to graduate 20 nurses a year. This year, we're going to graduate 39. Mm-hmm. Next year, 72.
Ooh.
And freshmen. So we have a joint program with Alvernia. And Alvernia, they do their first year of education at Alvernia, so they're our great partner. We have 163 students that began the program their freshman year. And one of the nice things we do as a network, we provide free education. If you agree to join us for 3 years, we'll pay for your tuition. So you could go and get your degree in nursing and have no cost.
I was at Vito's and someone came up to me and said, Sam, we saw the show with the nurses and I'm an RN, I'm retired. She was, I think, maybe 62, 63. She said, you think there's any opportunity for me working at Lehigh Valley. So are you looking for people who are RNs or, part-time or whatever?
So we're always looking for nurses. They're a very valuable resource. We will take nurses that have been out of the field for years and just have a quick refresher for them to make sure that they're comfortable taking care of the patients.
So Terry, I understand there was something interesting happening at the hospital. It was called a mission moment. Tell our viewers about that.
So our healthcare workers do incredible things every day, and there's so many examples that we could share with you on how we fulfill our mission. But the one we'd like to share is Beth Sheeler and Penny Klinger. Beth works in our cardiac office of LVPG, and Penny's our physician liaison. And there was a patient that needed a cardiac cath in Allentown. They didn't have any transportation. And our team was so dedicated to getting this done, they jumped over many hoops, they made many phone calls, because we had arranged for transportation for this patient down to Allentown and transportation home. This patient needed this cardiac cath. Our staff easily could have just given up, but they jumped through hoop after hoop to make sure this patient got the cardiac cath. And we're happy to say she's alive and well and doing well at home.
And anything in closing you'd like to tell our audience?
No, I just want to, it's this time of year to be thankful. So we appreciate all the patients that do choose Lehigh Valley for their care, and have a very happy holiday season.
All right, now we're going to take a break. We'll be back with Dr. Riddles right after these messages. Well, welcome back to your community partner, my friends, brought to you by Lehigh Valley Hospital, Schuylkill. You just heard from Terry, who was giving us a lot of great information about what's happening here in the hospitals. And now joining me now is Dr. Lawrence Riddles. Again, there's so many things happening. Let's talk about the medical staff and the doctors and the advanced technicians. And
Sure, and I think last time you and I talked a number of years back, we talked about how we had a senior medical staff. It was about the average age of about 62, and obviously the medical staff and being able to sustain and refresh them is such an important thing, and we've had very good success in that in recruiting. And we've added a number of folks. Some of the folks that we have added, Dr. Chalik is a local neurologist here that is elected to come and join us and supplement our staff. So it's great to have neurology with stroke and a number of other things that we deal with here, and having him as part of that is huge. His two advanced practice clinicians, Dave Heath and Colby Powell, are with him up on the Tunnel Road practice, and we're very, very excited. That's going to give us a lot of local access and continued local quality for neurology, which they've been doing for years. We've had a couple of others. Actually, we have one doctor from in the Pittsburgh area, Dr. Canali, who interestingly is going to be doing our telestroke. It's where we do virtual stroke. Is that we found, as have all their health systems as well, is that with all the specialists we need, we can't get them all physically at one place, so we're able to use telemedicine. And with the telecommunications devices we have now and the quality of the audio and visual, it's almost, not quite, but almost being right there, so that we can have availability again for strokes and things like that, or cardiac issues, or really almost anything. We can have specialists virtually at the bedside, which is huge, so we can determine how best to treat them, and then those that need to, we can move them down to Cedar Crest, our major medical center, academic center, if advanced interventions and so forth are needed. So we've had good luck. She has joined us, and then Dr. Alma Kav, and also we have Dr. Manny from Heme Onc, Dr. DeVecchio, who's rheumatology, and then probably one of the most exciting things we have is that, and again, I think we talked about this a little bit, is our family medicine residency in rural medicine, if you will, is really developed. It's a 3-year program, and each year we have 4 students or residents come join us. And this year we have now got all 12 on board. And actually this coming June rather, we'll graduate our first class of rural trained family medicine docs from here. And actually the really exciting thing is that 5 of the 12 that are in now have elected to stay in Schuylkill County, and we're really excited about that. Is that they've really gone into working with the community. They've got programs. One is a walk with a doc, where you actually meet with community members and take a stroll, if you will, but you actually get a chance to meet them and talk with them. They're also very, very involved in a lot of the community activities over here. So that what we'd hope to have is that we are training specialists in family medicine to practice in a rural area, but on top of them, they're also joining the communities now, which is huge. So back to the, if you will, the refreshing the medical staff and so forth.
Looking at the program, how does that program work, the residency program?
The residency program, this is associated with Lehigh Valley's family medicine program in the Valley, but it's a freestanding but tightly associated residency program here. And as I mentioned, we recruit for or take applications for family or medical student graduates, if you will, that want to do family medicine. In addition, they also want to practice in a rural community areas, such like Pottsville and Schuylkill County and all of those areas in general. It requires some expertise in that you have to be able to understand the disease processes that are here, the things that are challenges as far as transportation, life choices, all of those type of things, and then being able to practice in an environment where you don't have a full academic medical center right there. Although if they need anything, we can certainly then transfer them down. But the goal here is to provide care in a home community, if you will, as opposed to just saying, oh, you need this, here's your ticket, you go down, get that and that. We can treat and take care of quite a bit here, and they're specially trained in doing that.
Are you recruiting now?
We are taking applications for next class.
I want to go back a little bit what you were
Please.
saying about telemedicine. Okay, and you often hear, when someone says, I went to the doctor and they told me this, and they say, well, get a second opinion. Okay, I think maybe sometimes a patient doesn't realize that when you're coming to Lehigh Valley, you're getting more than a second and third opinion, because they confer with other doctors.
You have a number of folks working with you, right?
And that telemedicine is just amazing, isn't it?
It really helps, because one case in point is that urology is one of many specialties that are very hard to get enough of them, because they typically will be in and around major medical centers. The reason is they're very highly procedural requirement type of thing. But the needs are huge, and in Schuylkill County and Pottsville specifically is no different there. So what we're doing now is we're putting in a virtual hub for urology, so that folks, either through their primary care provider or calling down to our phone number down in the Valley to the urology clinic, can get a virtual appointment. And right here at Laurel Boulevard, we have a virtual hub, if you will, a specialized area that's set up again with the telecommunications and the high-end cameras and so forth, that the medical staff then checks you in, and then you are sitting there talking to the urology specialist. Wow. They can work through those things, and then again, if there's things that they identify that are above the level of what we provide here, we can make arrangements to have those sent down. So,
but I think that's critical. That is very critical. There's a big need for that.
Right.
And as that happens, if someone's having a concern, I guess, does it come from the family doctor, though?
Not exclusively. Many times when they see their family doctor or a primary care provider, they'll identify issues that they need to be seen for, somebody that has stones or something along that line, and then they'll refer them. And now, instead of saying, well, you have to go down to Cedar Crest to be seen, we will virtually bring the doctors up to see them. And many times we can sort through and start them down treatment protocols without having to send you down. And then certainly, if we find things through CAT scans, other imaging and so forth that need something more, we could certainly send them down and arrange.
So Larry, how long have you been practicing?
Oh, a long time, 40 plus years.
I was reminiscing with Terry about 25 years ago. We started doing health shows down here. And the advances in medicine, that I see, let alone what you've seen, is amazing. I mean, you just could write a book as to what has happened in healthcare over the last number of years.
When you see how we used to say that when you come out of medical school, 50% of what you know or what you've been taught is wrong. The problem is we can't tell you what 50% of it is. And it's even faster is the refresh rate, if you will. About 18 months, and you have brand new things. My daughter just came out of medical school not that long ago, and the things that she's learning or had learned, we didn't even know those at the time.
Wow.
Kind of probably a last example is the very end of one of our immunology courses in medical school. You get to learn the fun stuff the last couple of days of school. It's like in any school where the teacher starts telling you the neat stuff at the end of the course. They said, well, we have this thing going on now that we don't know what it is, but we find some patients where their immune system just shuts down. We don't know what it is. That was the start of AIDS. And what that led into and all the things we learned from there have been just spectacular as far as the immunology, the suppression, transplant, all of that kind of grew up together as we learned more and more about it. But that all was just starting when I came out.
Yeah. And what your experience going with the Lehigh Valley Health Network is just amazing what they're doing in terms of...
It is spectacular what they're doing. The instrumentation, the procedures they're doing, the biomedical, if you will, now, the biopharmacy and so forth, targeting certain areas, certain particular things with cancers, that we can identify certain things in the cancer that we can then target with pharmacologic agents or with very exacting surgical or energy delivering devices and stuff.
So being around a little bit, okay, I'm going to ask you a question now. Okay, I won't...
Yeah, I'm not 18 anymore.
No,
Yeah.
no, I'm gonna, so and you don't have to answer this question, okay? Are you happy with the merger with Jefferson?
Yeah, I am very much so, because Jefferson as well as Lehigh Valley really have very similar views of how they do their goal being really we make lives better and then we heal, comfort, and care for them. We're also focused on trying to get the best medicine for the folks that need it the most. They're more urban located. We're more, if you will, rural, or not exclusively. Plus, we're far enough apart. We're not fighting for the same piece of pie. We're trying to grow, bring together things. And probably the last thing that is really very important is that they also have a health insurance product that, while you may not think of it much, is critical, because that allows them to be able to manage the risk. When I say risk here, is that health care is very expensive, but then being able to pay for it can be very difficult. And if you do it right, you can offer insurance products that are affordable and yet cover the risk, and that's really where I think we're going to really excel and grow along with Jefferson. So I'm personally very excited about it.
That's good. It's always nice seeing you.
Likewise.
And
I look forward to seeing you again.
You're learning all the time, right?
Yes, sir.
Now that my friend Father Brosk give you enough
Yes,
information?
sir. He's leading me to a better life.
That's good. Thank you. Very knowledgeable person. I want you to know that.
Absolutely.
So you're watching, now listen, if you have any comments or questions, I know I got a lot of them and I never get a chance to ask them. That's why I snuck a couple of questions in Dr. Riddles here. Sam@ssptv.com. Any questions you have, any comments you'd like to make, please. And all these shows are on our website. You know, if you don't get the on cable, which you should, they're all on the website. All the health care is on ssptv.com. You get all this valuable information. We'll see you next time.